So there's always going to be situations where you come into a nursing home and find things not quite right, just not the way you want them to be. That's pretty natural, and it's going to happen, and facilities expect that. Most of the time you're going to find that a facility has a pathway for you to come in and talk to people, talk to various people, the right people, to get that solved. Depending on the type of concern is going to dictate how quickly and who you go to. Certainly if there's a food item that doesn't agree with the resident, or there's a missing laundry item, it would fall into a lower level than a care item of great concern to you. In that case, you need to talk to somebody perhaps different than you would for a laundry item or a food item. The first thing I'd recommend is that when you come to the facility, you try to understand what the caregiving situation is. There's certified nursing assistants who give the care bedside to the patient on an everyday basis. In some facilities, there's what they call dedicated care staff, where it's 1 or 2 or 3 people who come in 7 days a week, and you see those same people, each time you come in, one of the 3 people. In other situations, caregivers are not dedicated, but respond in order of precedence. When a call light goes off, no matter who it is, the first person to see that call light would answer that call light and take care of the resident. So knowing that, whether there's dedicated caregivers or caregivers who respond immediately when things happen, it's an important concept to know. In the event that the facility does use agency or contract staff, you may be speaking to somebody who's there one day who isn't there anymore after that. So you need to be able to ask the person that you're talking to whether they're a permanent staff member or whether they're a contract or agency staff member. The third thing I'd mention is the shift pattern. Typically in a skilled nursing facility, you have something like a morning shift that's a 6 to 3, 6 to 2:30 shift. Then you have an evening shift that's a 3 to 11 shift. And then you have a night shift that's typically an 11 to 7 type shift. Knowing that and knowing the crossover times, you may happen to come in when one shift member is just about to leave the building. I think you want to be aware of those times and be aware of those shift chains, so that if you come in and you talk to somebody who's just about to leave, your message might not get communicated to the next shift. Important information that you need to have. So I'd like to talk about the hierarchy of approach that you would use in, lodging a complaint or a situation that doesn't seem quite right. Your first line of defense, if you will, is to go to the direct caregiver, the certified nursing assistant, and explain your concern. If at that point it doesn't register with them or you don't get the results that you want, you need to go to what's called a team leader, who would be the boss, if you will, of the CNA, or a nurse manager, the person who runs the particular unit, that your loved one lives on. At that point, if you still don't get satisfaction or things aren't moving in the right direction, you want to see a member of the administrative team. I would ask a social worker to talk to, or I would ask for the director of nursing or the administrator to talk to. At that point, you've risen to the highest ranks in the facility. There is a hierarchy, there is a pathway for you to follow to ultimately get your problem taken care of.